Schools will close from 12:01 a.m.
San Franciscans to remain at home.
I'm David Renner. For the past 4 years, I've been using the expression, never in my lifetime, pretty often, more than I ever had before. But now at the start of 2020, we find ourselves in absolutely uncharted territory. The world probably hasn't seen a pandemic so rapidly devastating for a century.
Italy, there are now more than 30,000. Spain, which has locked down its 47 million. Chancellor Merkel has banned religious services and venues.
Today on the New Yorker Radio Hour, we're going to look at the scope of the Covid-19 crisis, which in a matter of weeks seems to have altered just about every aspect of our lives. We'll look at the human costs, the painful decisions, and the economic impact that will touch everyone. That's ahead today on the New Yorker Radio Hour.
Live from NPR News in Washington, I'm Barbara Klein. Negotiators on Capitol Hill are nearing agreement on a $1 trillion+ coronavirus relief package. NPR's Amy Held reports top-level talks today between the White House and Congress are aimed at rescuing a rapidly deteriorating economy.
Today, congressional leaders are meeting with Treasury Secretary Steven Mnuchin to hammer out details of the third coronavirus response bill, after bipartisan Senate negotiators worked late into the night finalizing measures for a massive undertaking. The package attempts to address a slew of crises, including millions of workers now sidelined, hospitals and patients struggling under the weight of the epidemic, and industries like airlines hard hit by the national shutdown. Senate Majority Leader Mitch McConnell says he expects the bill will pass tomorrow with overwhelming bipartisan support. But a spokesman for Democratic leader Chuck Schumer says they still have not seen large parts of the Republican draft. Amy Held, NPR News.
New York City Mayor Bill de Blasio says the number of coronavirus cases in the city have surged to more than 8,000. He's criticizing the Trump administration for not utilizing the Defense Production Act, which would allow the government to order private companies to manufacture items needed to fight the outbreak. Federal Emergency Management Agency Chief Peter Gaynor says the act is leverage, but companies are stepping up on their own. Several city leaders across the country are battling price gouging. Los Angeles City Attorney Mike Fewer says LA has laws to combat the practice.
No retailer, no seller can sell a good, a service, medical supplies and so forth for more than 10% more than they sold the item before the emergency. And we're seeing numbers much higher than that.
Italy, Europe's epicenter of the pandemic, is shutting down all production facilities except those essential to maintaining the nation's supply chain. NPR's Sylvia Poggioli reports the decision follows another record rise in deaths.
In a late evening address to the nation, Prime Minister Giuseppe Conte said this is the country's most serious crisis since World War II. Responding to demands for tighter measures from the hardest-hit northern regions, Conte said only activities that are vital for national production will be allowed. He reassured Italians that supermarkets, pharmacies, postal and banking services, and essential public services, including transport, will be ensured. We are slowing down the country's production engine, but not stopping it, said Conte. Lombardy regional officials went further, ordering all guests out of hotels to be used now only for emergency purposes and banning all outdoor sports or exercise activities. Sylvia Poggioli, NPR News, Rome.
This is NPR. Belgium is on lockdown for the next 8 weeks, at least. Belgians are allowed to leave home only to buy food, for health-related errands, or to help someone in need. Police are patrolling the streets to enforce the restrictions. Belgium's health minister says the decision is based on what happened in China and South Korea. The U.S. government is warning against non-essential travel to Japan. NPR's Anthony Kuhn reports Japan now has more than 1,000 COVID-19 cases and 36 deaths.
The Centers for Disease Control issued a level 3 alert citing widespread transmission of COVID-19 within communities in Japan. It advises travelers returning from Japan to stay at home, monitor their health, and distance themselves from other people for 14 days. Japan returned the favor on Sunday by advising against non-essential travel to the U.S. In a message on its website, the Foreign Ministry cites President Trump's declaration of emergency and U.S. travel restrictions as reasons for the warning.
contributors include Subaru. The redesigned Subaru Outback has standard symmetrical all-wheel drive and 8.7 inches of ground clearance for all weather conditions. Love, it's what makes Subaru, Subaru at Subaru.com.
This is the New Yorker Radio Hour, a co-production of WNYC Studios and the New Yorker.
Welcome to the New Yorker Radio Hour. I'm David Wren. We're broadcasting from my place this week. And just like millions of people, we're working from home. And we're the lucky ones. Closures and quarantines have absolutely swept the nation last week. Schools, restaurants, small businesses, you name it. Many are already out of work, and many more are worried about being out of work soon. And in so many industries, people are working at jobs where they don't necessarily feel safe. Hospitals across the world are already beginning to come under tremendous strain as the number of cases goes up and up. And although the United States is behind China and Italy, in some places we're beginning to feel the strain already. Dr. Arya Nishat is an ER doctor in Portland, Oregon, preparing for the flood of COVID-19 patients they've been seeing in neighboring Washington. Dr. Nishat, hello, how are you?
I'm good. Thanks so much for calling.
Well, we're reaching you early in the morning on the West Coast. What's it like to be working in an ER right now?
Well, to be honest, we are expecting the rush to come in probably in the next 5 to 10 days. Right now it feels very much like the calm before the storm.
And what kind of preparations do you make during the calm before the storm? What can you do?
Well, the data from China and Italy is obviously very disturbing, and the number one thing that Americans can do right now is shelter in place. We know that people are walking around and are probably COVID positive and don't even realize it because they either have no symptoms or have very mild symptoms. Right now in Oregon, we're very limited in terms of our testing capabilities. Everybody is trying to ramp that up, but right now we're only able to test those people who are truly acutely ill and hospitalized.
Are you talking to colleagues in Washington State, which has been really hard hit? And what are you hearing there?
I'm hearing that they are definitely seeing the surge already. They are ramping up all of their services, ER services, ICU services, ventilators, and they are very concerned. They are not sure how bad it's going to get. It's just started there in the last week or so in Lower Washington, and I think they're struggling to keep up. And I think one of the big issues for us on the front lines is we don't have enough personal protection equipment across the nation. And Oregon sent out a notice saying we have 2 weeks supply essentially, and they're asking for the feds to resource us better. And we've gotten only about 10% apparently of the ask from the federal government. And so you're asking frontline docs like myself, like other physicians, to be there for our patients, which is what we train to do. It's what we're excellent at. It's what we're prepared for. But just like we wouldn't ask a fireman to run into a building without protective gear, it's feeling very uneasy for us that we're being asked to take care of a highly infectious disease that we have a really good chance of getting doing procedures like intubation without having the right gear to protect ourselves and our colleagues.
What is it that you're short on? Masks? Disposable gowns?
We're short on N95 masks, we're short on surgical masks, we're short on gowns, we're short on pappers, which is basically a self-contained device so that nothing that is aerosolized in the air, which commonly when someone is coughing, they're aerosolizing the infectious agent. We don't have enough pappers to go around. And I think the ask that the medical community has is really for industry to step up. We know that pappers exist in research labs. They exist in other settings where there's research and development going on, whether it's in the pharmaceutical industry and technology. We need those devices made available to frontline healthcare providers right now.
This has got to make you very anxious about your own health, being in a frontline medical position, knowing that the onslaught is invariably coming very soon.
It's definitely nerve-wracking. I will be honest. I initially was like, okay, I can handle this. I'm an ER doc. I've been doing this for almost 20 years. And yesterday, one of my colleagues was like, wow, you seem more stressed than usual. And it kind of occurred to me that, yeah, I am more stressed than usual. I'm a single parent. I have 2 very young children. I have underlying asthma. I can't put myself in a position where I orphan my children. And that's a really tough place to be, between knowing your professional duty and knowing that you want to be there and stand side by side with your colleagues, because we are the experts in how to manage a crisis, and at the same time weighing the implications of, what if I do get sick? What are the implications for my family?
There seems to be a number of evolving guidelines for doctors. What's it like to practice medicine under those really unsure circumstances?
Well, I would say we're all obsessively checking our phones, and we're all obsessively talking to each other within private chat groups amongst the physicians, but it is confusing. We get different messaging depending on the day, the hour. Obviously, the federal government has failed miserably in preparing the country for this pandemic, and for months was saying this isn't a problem. And so there are people who, driving home from the hospital yesterday, were congregating. And granted, most of them were in groups of less than 10, but there's this atmosphere of, oh, we're off from school, we're off from work. And some people really aren't taking it seriously and aren't social distancing, and we're not going to be able to flatten the curve this way.
Make you apoplectic.
Yeah. I was pretty mad when I got home last night, and I had observed in my own neighborhood a group of approximately 10 people congregating and laughing and joking around. And part of me is like, am I overreacting? It's a group of less than 10. They've been told that they can congregate. I think because we are so mindful of what's coming, it almost feels oblivious.
Doctor, all I can do is say I wish you the very, very best. Thank you so much.
I appreciate it.
Dr. Ari Nishad from Portland, Oregon. This is the New Yorker Radio Hour. The loss of human contact that's come with quarantine and social distancing can either be a mere colossal inconvenience, or it can be truly heartbreaking. Jayan Fan is a staff writer for The New Yorker, and her mother is in an elder care facility which now has a visitor ban to protect the vulnerable population, and that has Jayan quite worried.